As you get older, things do hurt, but when is having surgery the best option? There are a lot of things to think about before making that choice. This afternoon we have Dr. Richard Miller, a Mercy orthopedic surgeon, to help us out. I got to ask you, has anybody said, Doc, it hurts when I do that? And you said, don't do that.
All the time.
An old joke, right?
Yes.
And everybody, since you know your business, people ask you about your friends, neighbors. Oh, wow, it hurts when I do that.
Yep, absolutely. We get it all the time.
So I guess there's a dividing line of as we get older, we get more aches and pains. That's part of aging. I guess you rely on a doctor to tell you, well, that's more of an injury that needs taken care of, and it is just give it some rest or maybe some therapy or something like that. How do you look at that?
Yeah, so when people come in for those types of things, we really try conservative measures first. If those have been exhausted, then we start talking about other options, including surgery.
And a lot of times, though, you can get an MRI and see, yeah, the joint is messed up. It needs to be, we need to do something with that. The therapy is not going to repair the cartilage being gone, right. A lot of times with a shoulder or a knee or something like that.
Yep, no, that's true. If we get to the point where symptoms are just not controlled with normal conservative measures, and imaging studies show really advanced degenerative changes, then joint replacement becomes a reality.
In the time you've been doing it, how has the technology assisted you in how you do your job? Because you could get a better feel for what's happening with the newer technology.
Sure. I mean, imaging has come a long way since I started 150 years ago. So that's very, very helpful. People are by and large pretty active, and so that helps as well. And then, we have things in orthopedic surgery like robotics and things like that can be real helpful as well.
What joints are more apt to break down? I know it depends on what kind of activity you do, but are knees being replaced more than hips and shoulders, or what's the pecking order there?
Yeah, I think traditionally knee replacement has occurred more often than hip replacement, but that's starting to equal out. I see a lot of patients with hips as well.
And what's the life expectancy for a new joint?
Yeah,
I guess typically you hope you don't outlive your new joint, but sometimes maybe if you're an athlete and doing a lot of activities, you wear out even the metal goes down quicker.
Sure, and it's a great question. We talk about this in the office all the time. Traditionally, knee and hip replacements have lasted about 15 to 20 years. We would argue that over the last 10 years, our manufacturing processes are a lot different. The metals and plastics that we're using are a lot different. We'd like to believe the joints we're putting in now will last a lot longer. 40 years from now, I'll have the exact answer for you.
The three different joints, if you're talking a shoulder, a hip, and a knee, the mobility is totally different. It's a different kind of, because the knee does not go backwards, but the arm needs total mobility. What makes it a more difficult surgery to put the thing in right and make sure it's going to be productive?
Yeah, I'm not sure if it's more difficult, it's just knowing how to do it. And I think that's the same in any profession. The implants are designed to allow for that kind of, changes in mobility needs. And then, we train to learn how to put those in correctly. So,
if someone's having mobility problems, how do you get started on the path toward replacement? They first come to a doctor and do all the tests.
Yeah.
Walk me through it.
I mean, so if somebody comes to me and they need a knee replacement, they're stiff and they're having trouble getting around, one of the first things we do is get them into physical therapy so we can restore some range of motion and some strength around the injured joint. Even if we know we're going to be heading towards knee replacement down the road, therapy and improving function prior to surgery can be really, really beneficial.
Yeah, because if you do have more mobility around the joint and you replace the joint, that probably speeds up the recovery process in rehab.
Absolutely, yeah. If you go in really, really out of shape, not able to do most things, you're going to struggle with the rehab afterwards. You can certainly make that easier by prehabbing prior to surgery.
What's the typical recovery like for most of these? They're probably all different, I would guess.
They are. Knee replacements, I tell people you're going to be 80% better at about 3 months and 100% better at about a year. Hip replacements, I do them through the front of the hip. That recovery is much, much quicker. About 80% better at 6 weeks, 100% better at about 6 months.
But the thing is, you get the hip replacement or the knee replacement, you have to do the work. You have to do the rehab work. If you're I know they're good about getting you up right away and working on the joint and walking through it and getting used to it, whatever joint it is, using it. But like if you're not willing to do it, it's going to take, your recovery process is going to take a lot longer, and the joint may never get totally comfortable.
Yeah, I mean, you want to see the full potential of the joint replacement. That requires a patient to be really, really engaged in the rehab process.
Yeah, and I got to think that if you're having a replacement like that, you want to get to where you don't even think about it.
Right.
This knee just feels like it's always been there and no problem at all.
Yeah.
How long does that take?
You know, it's funny, we have a scoring system in orthopedics called the Forgotten Joint Score.
Yeah.
And it's that exactly. It's how many people can get through that process of surgery and rehab and get to the point where they really don't feel like it's an artificial joint anymore.
That's good to hear. Yeah. Dr. Richard Miller, thanks for coming in today. Appreciate it. Orthopedic surgeon.